Friends, welcome to my YouTube channel, and in this video I will tell you about current diagnosis and treatment of anxiety disorders. Anxiety disorders are the most prevalent mental health conditions, although they are less visible than depression and bipolar disorder. They can be just as disabling. The diagnosis of anxiety disorders are being consistently revised. Both dimensional and structural diagnoses have been used in clinical treatment and research, and both methods have been proposed for the new classification in the Diagnostic and Manual of Mental Disorder (IV). However, each of these approaches has limitations. More recently, the emphasis in the diagnosis have focused on the genetic research. This approach is based partially on the need of a more comprehensive understanding of how biology, stress, and genetic interacts to shape the symptoms of anxiety. Anxiety disorders can be effectively treated with something and cognitive behavioral intervention. These interventions have different symptoms targeted, thus logical combination of these strategies need to be further. So anxiety disorders can prevent in up to 13.3% of individuals in the United States, constitute the most prevalent subgroup of mental disorders. The anxiety of their prevalence was first revealed in the catchments area study about 26 years ago, despite their wild something. So advances in anxiety research over the previous decades are likely to be reflected in modifications of diagnostics criteria in upcoming DSM, planned for publication on May 2013. For instance, post-traumatic stress disorder (PTSD) and obsessed uh, disorder have been reclassified in the separate domain of trauma and stressor related disorder and observed compulsive and related disorders. In this article, we review the challenge to diagnosis of anxiety disorders, provide a model that explains how anxiety symptoms occurs and change over time, highlight the something system affected by these disorders, and discuss the role and relative effects of the non diagnostic dilemmas. Whether the past 10 years or so something data have been used, the result of the approach have been progressively related from DSM and finally to DSM-5. However, these efforts have been harmed by the extensive presence of commodities in patients with anxieties. For instance, in patients with some disorders such as generalized anxiety disorders (GAD) and some anxiety disorders (SAD), the presence of commodities is a rule rather than expectations. In clinical practice and in research, it is not usually to find the consistence of two or more diagnosable conditions in the same patient, or at least synthetic overlap. Thank you so much for watching this video. I will see you in the next one. Have a nice and wonderful day.